Hi, I'm Dr. Raj Aquila. I'm UK Ambassador and Global Key Opinion Leader in Facial Medical Aesthetics. Welcome to my series of online training webinars. Okay, so look, temporal fusion line here. The intersection of temporal fusion line with orbital crest. 1 centimeter up, 1 down, and back to the orbital crest right here. So this square is what you're looking for in terms of where you'd like to inject. Turn this way. So when I palpate within that square, as long as there's no pulsation, you're okay. Because sometimes there's a little frontal branch. There is actually one very immediately there. So you're good to go. Also look for the veins. There's a sentinel vein here. You must have all hit that at some point when there's a venous bruise. Yeah. So take care. And then down we go. So perpendicular, straight down, touch the bone. At this point then, big bubble. And give it 3 seconds. Allow blood to come if it's coming. And then that's it. Good to inject. Nice and slow. Immediately, even after 0.1, 0.2, you'll start to see, Rami, that this eyebrow should be elevating and being more laterally displaced. Yeah. So, and then look, I come out slowly. I said this thing, didn't I, about not pulling out so hard because then you can have issues. With the molding the direction of the lift that you want. This way. And by the way, this thing about brow displacement, you know, there are those patients that actually need brow depression, right? Yeah, I manage that with Toxin. So she's got much better lifting of the upper lid, and you see the heaviness in the fold here has been displaced upwards like that. Lateral canthus should also be more up, and this transition should be better as well. Show me a big smile. Relax. Good, okay. Super, right, now let's go to the cheek. I'm going to lift her this way. There's the notch. When I pull this back this way, the notch is now here. So basically, the cutaneous insertion of that ligament is here. The bony origin of the ligament is here. So you want to inject there or just in front of it. It's that specific, because otherwise you miss the opportunity for lifting. So just ahead of the notch, onto the bone like this, and then you can inject. So 1 to 0.3 cc, and then this is done. So, thanks, darling. So look, what I'm going to do now, I'm just going to mold laterally. I'm squeezing it now up to the edge of the ligament. And then after I've done that, I'll do this more of a HD molding, so like this. I'm going to then trap it on the inferior border of the zygoma, like so. And you see when I do that, I cut her right in like this. This is a great thing to do with beautiful girls. Like, you know, you really want to take their glamour level up, do that to them. I'll do the same thing in a jawline in a second, okay? So, malar mound, mid-cheek groove, so zygomatic retaining ligament. Therefore, your injection has to be just medial to that, okay? Just there. So retract backwards. Straight down and sorry to the bone. You got to get to that bone. So 0.2 should be enough. Take the mound excess, take the product, and mold it against the zygomatic retaining ligament like this. And as you mold it this way, it reduces the mound, okay? And then also, send this up towards the tear trough. So send it upwards and it slides against the zygomatic retaining ligament and it goes up in the SOOF there and it just starts to touch the tear trough here. So when she rotates her eyes upwards, I can see the tear trough better. I'm now going to go through the skin, through the muscle, through that SOOF and then get onto the bone. Now look at this. Look at the amount of needle. It's a 13mm needle, right? How the amount of needle I need to use to get to the bone. And many people are not injecting deep enough here and then they're getting problems. So you have to be on the bone and push it forwards. So 0.05 to 0.1 max here is all that's required. So this is the point here where you've got the cutaneous insertion of the orbicularis retaining ligament. The attachment of this ligament is tight here. It becomes more loose as you go more laterally. So what you want to do here is you want to get on the bone and you want to go just below the ligament. Okay? If you inject superior to the ligament, you're going to end up with product entering the infraorbital fat and you'll make the eye bag bigger. Okay? So I'll show you the dot again. So what I do is I pull the lateral canthal ligament out of the way and lift it upwards. Then I'm going to go vertically down and go touch the bone, then inject. And then when I see the lifting, it's done. So take that little ball and then squeeze it up against the lateral canthal ligament like this. Okay, I'll show you this. So buccal maxillary ligament, facial artery, safe point. So look, facial artery is here, lateral to it. So you see how close you are to danger. So what you have to do here is pull the artery away, get a lovely steep trajectory, and then take it right down onto the bone. Make a big, big bubble, aspirate, and then we are good to go. 0.3 maximum for the compression risk. So what we're going to do next is we're going to work with jawline. So turn this way. The first thing I want to do is to pull it this way. So we're going to go with Voluma onto the angle of the jaw. From this position, when you go down here, sorry darling. Right, look, make sure that you are on the bone, okay? Don't be injecting in the muscle. Do the aspiration. And then you can inject. So actually, to answer your question, I'm kind of on the posterior border of this angle now. See, my angle is coming from that side, yeah? Giving some lateral extension. Because I'll actually help with the jawline much more when I get to this next one with the cannula. Now what you do is, look, you mould it in like this. There you go, look. So nice. There. Okay, really cute. And look, she starts to become lighter in the jaw as well. Okay, now we're going to go here with the Voluma. Done. So, pregial sulcus. This is the mandibular retaining ligament right here. I inject just in front into the pregial sulcus here, and then you make the injection. Look, it's on the lateral border. It's not on the inferior side where you've got the vessel. Now, you may think when you look at it, you'll probably think, actually, look what he's doing. What a mess. He's overcorrecting it. But I do it on purpose. I'll show you why. So look, I'm going to, see, with my 2 index fingers, I'm cutting it in like this. So it's really, really well defined. Okay, look. Take your 2 index fingers, see, wedge it in place and squeeze and make that really, really defined. And you see, you shape it like that. So nice. Look this way. Come this way. You see how she has this descent, and then on this side, nice and straight. Voluma on the submuscular plane. Don't touch the bone because you're close to the mental foramen. Actually, because it's quite hollow there, I'm still going to stay with voluma here. And then the next one will be with Volift though. Okay, thank you. So, bone, submuscular, subcutaneous, now intradermal. Okay, so we're becoming more superficial as we move from the base up towards the corner of the mouth. So, intradermal, take it, and the injection should not pass the mandibular retaining ligament. You just basically kiss the mucosa and you just pop it up. Do you see that? Yeah. You just pop it right up. So first of all, we're going to start the process of inferior descent of the chin, but also this mechanical blockade of the muscle. Do you see when I've got a sensitive area? In fast and then injecting slow. Yeah. So look, next one is going to go to the midline here. We start the injection from here. You've got to do it in the same trajectory as the cupid bow, right? So, and you've got to go through the GK, because then you can get a lot of wins with one injection. So, transcutaneous, staying nice and superficial, going to the midline, and then inject in the midline, and then gradually inject and withdraw. When you get to the GK, just hover there for a second, and then withdraw, but inject less as you come out. So there's the next target is here. So again, we're going to go transcutaneous, staying just under that mucosa, and then inject and then withdraw. So fuse that now into the vermilion like this, and that's it. And then up through philtrum, less at the top, a little more at the bottom. And she now has definition with a beautiful, can you see this concavity? And you want to generate that if you want to shorten a patient. So this is the GK point, this is the corresponding point in the lower lip. You want to leave this here. So all I'm doing now is we're going to go through, and then into that medial tubercle, and then inject and then withdraw, and as I withdraw it rotates outwards. Okay, open it. Close. Just give it a little pinch. See? When I pinch, can you see what I'm looking for here? Where there's a fold is an artery. Okay, so it's just lateral to that. Go straight down. Be bold though, okay? You've got to go straight down. Now, crunch. There we, did you see that? Little give, the little resistance, little crunch. And then aspirate. And then inject. When you're in the subgaleal level, look what happens. It hydrodissects underneath it, so you get quite a lot of radial spread from that point. And then that's enough. And just do very gentle moulding. And you get this lovely uniform light reflex. See? So just in summary, brow lifting, upper eyelid lifting, lateral canthal elevation, mid-face lift with definition and subzygomatic sulcus, projection at the OG point, restoration of tear trough, lateral canthal resolution, nasolabial fold, nasal narrowing, eversion of the upper lip. Show me the kiss with the lips. A reduction of the lines here, relax. Elevation of the oral corner, eversion of both lips. Contouring, straightening of the jawline, definition of angle of mandible. Extension of the chin, narrowing of the chin, and union of lower lip to chin.